Hello, everyone, and welcome back to Balm Health Plus podcast. I am Miteshri, your host for today's session. And today we are thrilled to have Dr. Margo Harrison, MD, MPH. She is a distinguished OBGYN and the founder and CEO of WaveBye Inc., which is a pioneering company focused on disrupting the menstrual health space by offering medically proven products to reduce period pain and bleeding. How cool is that? Thank you, Dr. Harrison, for being here.
Thank you.
And if you could, please take a moment to introduce yourself and tell us a little bit more about your work in this area.
Yeah, I appreciate the kind intro. That was lovely. I'm very excited to be here to talk about WaveBye. And as you said, yes, I'm an OBGYN physician. I trained and ended up going into academic medicine. So for a little while, I was a researcher and, spent a lot of time sort of in that space, getting grant funding, working on women's health from slightly other perspectives, and just felt like I wasn't having the full impact that I wanted. So a couple years ago, kind of left. I still work clinically a little bit, but I've really moved more into the women's health space from a business perspective, supporting and being a consultant for other companies, bringing that clinical expertise and that research expertise to those situations. And then, of course, founding my own company in the menstrual health space, which I feel like hasn't been disrupted basically in a century. There are some really good products that could be out there really helping people, and nobody's done it. And so I felt like it almost an obligation to bring these products to market to really help women understand how to be in control of their menstrual cycles and not feel controlled by the menstrual cycle. And so our mission is really to give people their time back, really help them understand the menstrual cycle enough to take our products properly for maximum effectiveness so they do reduce period pain and bleeding. And then if you start to understand your cycle and what's going on with your body enough to really take the products properly, it empowers women with a deep understanding with the menstrual cycle. And once you sort of have this deeper understanding of what's going on with your body, it doesn't feel so scary and separate from who you are. It feels like you're more aligned with that part of you. And I think you start to understand everything related to the menstrual cycle better. Fertility, contraception, perimenopause, menopause, they're all sides of the same die. So yeah, I'm grateful to be here. Happy to sort of chat about our products, specifically in the context of PCOS, or get into any questions you think might be relevant or helpful for your listeners.
Wow. Thank you again, Dr. Harrison. That is so moving, giving the power back to women so that they can have autonomy on their own body. They can understand what's happening inside their body system. And this is a great way to educate yourself and knowing better about how you can manage all of these symptoms and, pain and things like that that have been very long overlooked, and also I would say under researched when it comes to women's anatomy and a lot of issues that today's women are facing. So thank you so much for doing that. Now I'm just going to dive into some basic questions about period pain, irregular menses, and menstrual health. So just to start off, can you tell us a little bit more about the most common symptoms of period pain?
Yes. So the most common symptoms of period or of menstruation are essentially cramping and bleeding. And so I would say that those two pretty much characterize the experience of menstruation, but are flanked on either side by the experience of hormone changes throughout the cycle that can really affect how people are feeling on a daily basis. So, um, we've long talked about premenstrual syndrome and PMS and sort of how rapid hormone changes at the end of the cycle can really have mental and physical impacts in addition to the cramping and the bleeding. But if we're talking about, the menstrual period, people tend to have cramping, bleeding, and then with that change in hormones, headaches, bloating, and emotional dysregulation, mood symptoms.
Right, right. Thank you so much for answering that. So that brings me to the next question, which is like, what could be like the primary causes of this period pain, and how can we as women, identify whether this pain is normal or is it a sign of a more serious underlying issue or things like that?
So the way that your uterus makes pain is it sends out a bunch of different messengers in a pathway. Everything in the body is a messenger pathway, wherever it's happening in your cells, in your blood. Your body is communicating to itself, and then things happen as a result. So it's no different with the uterus. The uterus is sending out messengers and communicating no pregnancy implanted into the uterus. And so it's time to shed the lining and then begin that process again. So we have another shot at being pregnant. And so, when your body sends out messengers, it's not like just turning on the faucet on a sink and then turning it off. It's like turning it off, and then there's dripping and there's communications, and it's not totally efficient. And so, as your body is trying to turn on and turn off your period bleeding, it's a sort of a longer process, and it can be prolonged. It can cause too much bleeding, or too much pain. And I think the definition of what's too much really lies with the woman. Like, you can't ask your sister or your mom what their experience is like and translate it to you, because somebody may have very little bleeding and very severe cramps. And what I would say the definition of it being not normal is that it's really impacting your life. Like, you do not feel like you can be yourself. Maybe home remedies, maybe medications will help you. If those things help you and you can be yourself and get through the day, then that you've found some balance there. But if you're trying interventions and you feel that it is impacting your quality of life to the point that you can't be the person you want to be, I would say that's not normal. I would say, regardless of whether it's normal or abnormal, it's something that needs to be solved. You deserve to feel you like yourself. You deserve all month to feel like yourself and to have the choice of how much you want to experience the pain and bleeding.
I love that because it just makes me think that in my family, like me and my mom, we struggled, we couldn't go, like, especially the first day of our period, we couldn't go without Elevay or Advil or the hot water bag, just to get rid of the pain and discomfort that we were feeling at that point. And then we have, my first cousins, and they don't know what period pain or cramps are. So it always made me wonder whether it is, some underlying genetics that's at play, or is it more like body to body wise difference and, varying factors that might be contributing to the level or the amount of pain and intensity that a woman feels. So,
Yes, so everything is a normal curve and a distribution. And so there are definitely numbers and objective numbers you can put around the middle of the normal distribution and say, okay, the cycle should be, let's say, between 25 and 35 days. Or, you can sort of put people into a larger bucket, but that's even itself a huge range.
right.
10 days different
Yes.
for like a normal period. So, you do have to sort of step back from everyone else's own experience and start to focus on your own experience and start to understand, what am I feeling throughout the cycle on a daily basis? And then how is it impacting me around my actual menstrual period? And is it tolerable or intolerable? And like, I think the questions are super interesting around like, what's the etiology or what's the pathophysiology of that? And like, is it genetic? At the end of the day, it's you and it's the life that you're living. And you need to try different interventions to see what makes it feel more tolerable to you until you find a balance that feels like you can be yourself and you're able to continue to do what you want to do on a daily basis.
Thank you
So,
so much.
yeah, I think probably everybody's body speaks in different ways, and certainly with things like PCOS, there are interventions you can try to do to help that communication speak a little bit better. But no matter what you do, your experience is still yours. Your pain that you're feeling is still yours. Your pain pathway may be different from somebody else's pain
Right.
pathway. And so, um, there you sort of have to try the spectrum of what's out there, and we're trying to increase, the spectrum of tools that people can use to help themselves feel better until they find that spot where they feel they can really get through the day and be themselves.
I love that. It's going to be very personal and individualized till you figure out what's working for you and your system. So that makes me think, like, what does it really mean to have irregular periods? Like, what are the main factors that would cause a woman to have irregular periods?
Yeah, so to your point, I don't think the research is great on exactly what's happening to get the brain and the ovary talk. Again,
Right.
send out messengers, and the brain and the ovary and the body fat mass, all of it is hormonally active, and it's all talking to each other. And when you start to get irregular periods, something about that communication is not happening as efficiently as somebody who's cycling more regularly. And so that can be because you're an adolescent and you've just
Mm.
started your period and things are just figuring how to ramp up.
Right.
That could be because you're perimenopausal and your ovaries don't have the ability to produce the hormones like they used to. So you're ramping down on the irregular periods. And then there's sort of the PCOS spectrum of people in the middle who aren't communicating as regularly as other women, sending out those messages and receiving them. And I think what matters is the health implications, right? So, like, if you're trying to conceive,
Mm.
you want to have as many shots on goal as you can have, right?
Right.
So, like, getting a regular period, being able to plan, being able to have timed intercourse, like, these things are very important. Somebody never getting their period, they might be like, oh, fabulous. I'm never getting my period. I'm a field hockey player. I just want to play sports all the time. But not having your period can also be unhealthy cardiovascular wise, can be unhealthy for the uterus to have unopposed hormones and
Mm.
never sort of resetting that clock. And so it's important to make sure the hypothalamic axis is functioning as um, regularly as possible, sending out those messengers so that you can prevent health consequences like metabolic
Right.
abnormalities, and you can be able to conceive when the time comes and you're interested in doing that. And so, why that happens. I'm sure, like, I'm not, I don't know the most recent evidence on like the actual pathology of it, but like we can imagine we're not at our target weight. We're not eating potentially the types of foods. There's some hormonal interaction with the environment that's sort of
Mm.
messing with your hormone levels. So, um, I think again, it's a spectrum issue, and you sort of have to try all the different tools that are out there to help regulate it, starting with the least invasive tools and kind of ramping up over time to what might be more invasive to help you sort of get realigned in terms of your communication with your body.
Thank you so much for that information. Like, again, what I'm hearing is there is always that interaction between your body, yourself, and the environmental factors around you, which really are the deciding factors into how your periods are going to be, the impact it will have on your physiology, your mental health, and the spectrum. So, I just wanted to know, like, how does period pain or just having irregular menses could impact a woman's daily life? Like when we start talking about her physical, emotional, and mental health.
Yeah, so I mean, there's obviously the logistical piece of it. Like, you could be out in a white bathing suit somewhere and like not know your period is coming, and that's like
Right.
embarrassing and like whatever. There's always the logistics of sort of not being able to plan. But like I said, when the metabolic sort of structure gets a little bit out of whack, um, it can be dangerous for the uterus over time to just continue to grow the uterine lining without being able to reset it. So that can be dangerous over time. It can cause hypertension and cardiovascular disease. It can impact the ability of the body to really regulate insulin appropriately. This can lead to things like diabetes. Of
Hmm.
course, if there's some obesity in certain parts of the body. It can cause sleep apnea. So there are some real health consequences. The same way that if you never got your period, there are real health, on the other end of this spectrum, like you've lost your period. It's not just irregular. Like, you know, what we say is that the period is a vital sign. So if the period, isn't sort of continuing to function in the way that you expect it to, that's a vital sign that something's off. Maybe you're not eating enough. Maybe you don't have enough, body fat. Maybe there's something going on with your hypothalamic pituitary axis that needs to be evaluated. Maybe there's something going on with your uterus where you're not bleeding.
Right.
Maybe there's something going on with your ovaries where you're not ovulating. So, the broader picture here is like, it's not only just irregular cycles. It's like taking your blood pressure or your temperature. Your period is telling you a story about what's going on inside your body, and you should listen to it in order to help optimize your health and wellness.
I love that. Yes. Could you like highlight what could be like the mental or emotional health consequences of somebody who is facing, irregular periods or just dealing with menstrual pain in general?
Yes. So, I mean, a part of it is hormonal. Like, as the hormones change, there are very clear, this isn't like a made up thing, or like you're, like this isn't you, it's not a you problem, right? It's essentially a hormone problem. And so, yet again, instead of normalizing period pain, instead of normalizing mood disturbances and saying like, somehow internalizing it as if it's you, it's just messages that your body is sending out. And you don't have to feel like somehow it's your fault or something you're doing. It's just a reflection of the hormone balance and how the hormones are changing. And so drops in hormone levels that are sort of abrupt instead of, at different points in the cycle, can really, that withdrawal of those hormones quickly can cause headaches, can cause mood issues. And
Right.
certainly if you're sort of staying at high levels of hormones and the cycle isn't able to, you know, release and restart, you're certainly in a position where that those abnormal hormones levels will have impacts, hair growth, mental health, and other things like we talked about before.
Yeah.
So um, yeah, I think mental health is intimately tied with menstrual health. Mental health is menstrual health. Menstrual health is mental health. So
I
I
love that.
just think people are very, these things, they impact our brain. They're part of our brain. They have real outcomes for people. And, it's like you gotta figure out what your symptoms are and track them. And you should track your emotional symptoms the same way you would track physical symptoms, so you can start to see the picture of how your hormones are affecting how you feel.
Thank you so much for saying that mental health is menstrual health and vice versa. Just on a sideline, there is one question that pops up in my brain, and that is also because of the reels that I've been seeing on Instagram, where there was a TED talk where this person said that menstrual pain is now even being compared to somebody getting a heart attack every month.
Oh,
It's
yeah.
that intense. So
Yes.
how true is that, or what are your thoughts about the statement in general?
So this is what I would say. I provide abortion care here in the US, and I have a lot of patients who have a lot of feelings about the abortion. And one of the things they really have is fear of pain. And one thing that really impacted me was a lot of women were finishing the procedure and saying, well, it's not as bad as my period. They just had a surgery. And they said, it doesn't feel as bad as my period feels. So, you know, I think if your period is to the point that you're vomiting, that you're missing days of work, like, it doesn't really matter what the external comparison is. It's a reality for you, and nobody can tell you that's not your reality. It's your reality. It's affecting how you live, and you deserve to fulfill your goals. Like, if you want to live, if you have the ability to live your life a certain way, you shouldn't let somebody else tell you you can't live that way. Like there are solutions out there to period pain, to period bleeding, to PCOS. And if you value yourself and you value your ability to contribute to the world, you owe it to yourself to be your best self so you can achieve your goals, which is kind of our mission of our company is our driving belief is the belief that women have value and that women can contribute to the world and that they should
Thank
be
you.
able to fulfill their human potential. And if their period is standing in the way of that, then to me that's a problem, regardless if how it compares to their cousins or not, regardless if they have no bleeding, they have an IUD, but they're still feeling hormonal, depression and mental health
Yes.
issues. Like there's still an opportunity for intervention there. And so, I guess my belief is that like you should have all the education and the tools, and then you should choose if you want to use them or not.
I love that. Thank you so much. It was so empowering to hear that because, again, like every time I hear people saying that somebody else is disregarding the intensity and the pain that they have been feeling during their periods, it's kind of a battle lost because we are trying to educate here that your body is different than this person's body who's feeling all of these feelings, who's feeling this intense pain. And unless that person is taking an ibuprofen, that pain is not going away and that's affecting their quality of life. And that is such a reality. But some people, they just deny or they don't want to accept this. And then comes the whole like name calling or like saying that, oh, this person is weak, or stop being such a like a girl or something like that, which is very like, again, like it really seeps into the whole topic of sexism and things like that. But at one point you mentioned about medically proven treatments that are available out there. So can you share some of those treatments or interventions that are available for managing your period pain in general?
Sure. So I think there's a spectrum of options, and people should start at the bottom of the spectrum and see what works for them, right? So plenty of women can use like the heating pads. There is evidence based that like the heating pad does help. Some women will, call that a shower or a hot bath or something.
Right.
Sort of there are these interventions here on this end. But kind of once you get to like non-home remedies and you want to
Hmm.
do actual intervention, this is where I would say our products come in. So WaveBye basically has products that match the level of a person's pain. So let's say somebody has irregular cycles because they're an adolescent or in perimenopause or because they have PCOS. We do have a cycle regulator, right? They don't have pain or whatever. They can still take the cycle regulator to help with the hormone balance. So we have the cycle regulator and it's in all of our products. And then we have pain medication. So we have one that's fully supplement based. It's all evidence based supplements that you start 2 days before period bleeding and they reduce period pain and bleeding. We do have a medication that's a non-steroidal anti-inflammatory that's like ibuprofen. It just lasts much longer.
Right.
That you start 2 days before and it reduces your period pain and bleeding. And then our severe bundle includes both the supplement and the medication to try to hit it harder. So, this is sort of the middle of the road. Like, let me get on the cycle regulator. Let me try every day to remember my period and to start to cycle track so I can take those other products to reduce period pain and bleeding and get my time back. And then I think up here becomes like prescription interventions. And again, like you said, there's not a lot of women's health research. There's not a ton of products, but
Yes.
there is this like prescription part of this. And I do think that like going to the doctor can be quite intimidating with respect to period pain for all the reasons you just mentioned. But I think one thing you can do to empower yourself in the setting with a physician is to bring in data.
Hmm.
Okay. Like you can't just say, I have heavy bleeding and I feel terrible and whatever. You have to come in and say, look, I'm using this many pads in an hour. I am taking, over the counter ibuprofen, like four
Yes.
pills at a time. I am not able to go to school for 2 days. I am vomiting. I am having large clots. Like you can't go in and be vague, or you're going to get a vague response that writes you off. You have to go in with the tools and the information to show that you know yourself, you have
Hmm.
paid attention, and it is impacting your life and you're ready for intervention. And then I think up here with these prescriptions, again, not a ton of options, but prescription strength NSAIDs that can really be a little bit stronger. You know, obviously hormones, external hormones are some way that people regulate their cycles, birth control pills, patches, rings, you know, other interventions. And then I would say from like a PCOS standpoint, like you can certainly try our cycle regulator, but at some point, you know, if you really need to get pregnant or you really need to like break that cycle, there is some evidence that these GLP-1s are helping people lose weight and align the axis and get things back in check. And so I think that, you know, more data will obviously come out on that and we'll see. But, you know, those are kind of the more serious interventions. And of course, if you have endometriosis, again, we have terrible tools for endometriosis. But if you're experiencing like just horrific cycles, you
Hmm.
know, there's birth control pills. If they don't work, there are medications that essentially put you into menopause, but I think they can cause some fertility issues. And then there's surgery. There's always surgery. So, you know, I do think that you got to try the full spectrum of things. You sort of owe it to yourself to
Right.
start at the bottom and see what works for you and not jump to the top, you know, not jump to surgery because you had 2 bad periods, but see if you can, you know, intervene at different points along the pathway until you get to more significant intervention. But there are lots of tools out there now created by women for women that are also like apps
Love
and
that.
medical diet, you know, so there are some endometriosis specific ones that really help with diet and lifestyle, you know, change and things like that. So, you know, I'm not up on all the options out there, but I do believe that you should lean in on both the medical and the non-medical options to find the balance that's right for you and helps you take back your life.
Yes, I definitely agree to that. Like, see what's working for you and just stick to it. Or if you have to go to the doctor, like, mention what are the specific symptoms that you are facing and then ask for the appropriate intervention for that. So, I mean, what should a woman, like, really consider when choosing any one of these treatments? Like, as a woman, what should I know beforehand that will help me choose the right treatment for my issues?
I think again, I would start with the lowest level of intervention because, you know, nowadays people want to be very careful about what they put into their body. And
Right.
so, you know, you can always start with diet and lifestyle changes with yoga and with heating pads and sort of see what feels like it's making an impact for you. I guess what I would say is sort of figure out what the driving issue is, right?
Mhm.
Because if the issue is that you have premenstrual dysphoric disorder and like the 4 days before your period you can't get out of bed from depression, that's a different intervention. That's a SSRI type intervention. That's a medication intervention that's going to be different than if your issue is horrific menstrual migraines.
Right.
Um, so you kind of have to start to understand and pay attention to your cycle and pay attention to what symptoms are most debilitating for you so that you
Yes.
know how to treat them. Like if the bleeding or the cramping are the most debilitating issues for you, then you need to try our products. And if they don't work, then you need to go up to prescription strength. You know, again, our products should be able to prevent menstrual migraine as well if you take the daily. So you
Mhm.
want to try a supplement, obviously, first that's got third party testing and that you know is safe before you then go to a physician looking for treatments for menstrual migraine, unless you prefer medications and want to start there. Yeah, I think to answer your question, like what do women need to know? I think they just need to like step back a little bit and say, like, what are my goals here with respect to my period? Like, what can I tolerate or what do I not mind tolerating and what can I
Mhm.
not tolerate? And hone in on how to treat the symptoms that are most debilitating.
Thank you so much for sharing that. And you did mention yoga and stretching, physical movement, diet, and lifestyle interventions like that. So, do you suggest, or would you suggest, maybe a few lifestyle changes or self-care practices that can help women to reduce period pain at home?
I think that we live in quite a difficult world, and I think there's a lot of influences on us all the time. And so, you know, I think the best you can do for yourself is just pay a little bit more attention through all of it to what makes you feel good and what makes you not feel good. So like with eating is a huge part of our culture,
Right.
and we have all sorts of relationships with food. But like if you're suffering with PCOS and you have obesity from that, you may need actual medical intervention. But like, what can you listen to be able to help realign your relationship with food, for example? You know, if you're going on social media and you see a direct connection between coming off feeling bad and then a certain behavior, how can you remove some of the triggers, that are it's just, don't be mindless about your own body. It's yours. You're having anxiety about it. Lean into like what the symptoms are and what the chain pathway is that's giving you the anxiety about them, and see if you can help yourself in any of those pathways. So, yeah, I think, yeah, I mean, I think it's very hard. It's very hard to say do behavior change to women.
Right.
Like start doing yoga, start doing meditation, start doing stretching. Like, I don't know. I would put it back to you. We're having a panel this week, and one of my questions is, how do you people make behavior change? Like, what is it? What do women need? What supports do they need to make behavior change? I don't know exactly the answer. I think they need to feel valuable. I think they need to feel invested in their own health and that feel empowered that there is something they can do about it. So I think for that, they need the education and the resources. So, um, yes, I can easily say on this podcast, like, go do yoga. But when somebody goes to do yoga, even myself included, I'm obsessed with yoga and I haven't done it in years and I want to do it. So, like, what's the issue preventing me from doing something that brings me happiness? Like, how can I set up my own life in a way that supports me doing that if it is really important to me? So, I don't think these are easy questions. I think they're sort of the modern condition is like, we live in this world that is not built for our health. And so what small interventions or things can you do in your own life to build a context for yourself in which it is built more for your health than less for your health?
I love that. Giving back the power to the women to decide what's good for them, what are the barriers to, making those changes, or what are the challenges they're currently facing. And then even educating and being self aware that, okay, these are the things I like doing, these are the things that make me feel good. But at this point, these are the challenges I'm facing, which is preventing me to do that. So being self-aware, of course, like that's the first step, and then the action part, of course, comes in later.
Yeah.
So of course, as a CEO founder, I have to ask you this. So how do you see technology and healthcare evolving to better support women's menstrual health in 2025?
Um, yeah, I mean, don't know much about it, but if we're talking very specifically about technology, I think the best spot to be focused on for technology is technology that focuses on real basic science, right? Like you talked about, like what are the genetics underlying it?
Right.
What are the biopsies that we could do of somebody's uterus, or what markers could we be pulling out of their blood to show what patterns are we seeing with women with particular strains of PCOS? Like, how can we use large data sets to learn more about the actual pathophysiology of some of these situations to then develop interventions to help improve them? So I think when we talk about technology, I think the technology is moving quickly and almost there in terms of like online communities and apps and like education. And I think a lot of people have jumped into that space, and that's sort of like low hanging fruit, like build an app, like communicate with people, educate them. But I think the harder spot is the spot that you really raised right at the beginning, which is like, how can we diagnose endo minimally invasively? When somebody complains of period pain, why can't we send a test at the very first visit to see if they have endo?
Right.
Like why do we have to, and the reason that doctors kind of like poo poo women like that is not because they don't care. It's because they don't have a lot they can do. They just don't have a lot they can do. They can put them on medication or they can take them to the operating room. Um, And there's a lot of risk with going to the operating room, especially with endometriosis patients. So, I think it's just moving our tools further up in the pipeline, um, understanding underlying etiologies of disease and interventions that can pick them up earlier and treat them earlier. And um, I think maybe what motivates people, what can help motivate people is diagnosis, right? Like to our last conversation, like if you got a diagnosis of endo, all of a sudden you're very motivated to understand what endo is and
Yes.
what you can do and what's in your control. And so um, I wonder if we should be painting the period as like a diagnostic thing. You have this type of period, or you have this period pathology. Maybe we need a little bit more definitions there, and ways to diagnose people to give them the actual impetus to solve something that feels like a problem and not like just part of society.
Right. Um, Again, like, thank you for that insight, because as a CEO, of course, I want to know more about your product and your company's mission, and how did you like think of it, because to reduce the negative feeling and experience that a woman is facing when it comes to irregular periods or period pain. What motivated you to work on this area of research?
So I think what motivated me is like, I think I'm capable of great things, and I believe that the world shouldn't hold me back from the things that I want to create. And I kind of believe that for all women. I believe that all women are capable of all people. I believe all people are capable of some potential and that they deserve the opportunities. Why do I get to fulfill my potential or try to? And why does somebody else in a less fortunate circumstance not get that chance and that opportunity? And so that's sort of what I believe. And I believe in the case of women, being able to achieve your potential really requires a separation from your sexual and reproductive health organs. Do you want to use them? Do you not want to use them? Are they helping you reach your goals? Are they standing in the way of you reaching your goals? You know, it should be something that women understand, feel intimately connected to, and decide how they want to use.
Right.
And so that motivates me. It makes me do abortion care. It makes me do IVF care. It makes me start a company. The uterus is not talking so much to people and ruining their days, with this pain and bleeding. So I think the motivation here is one that, like, just like any human, a woman should be able to do what she wants to do and not be held back by her uterus.
Right, right. And how does Waves approach? How is it different from the traditional methods of managing menstrual health?
It's really differentiated by the premenstrual treatment and by leaning in on like whole cycle management. So we have a daily supplement that you take in the night at nighttime because it can make you tired, and that's going to really be working on your cycle every single day. That's going to be working on your irregular cycle. That's going to be working on your menstrual migraines. That's going to be working on your mood issues. That's going to be working on your anemia, and that's going to be working on folate for cycle regulation and preparation for pregnancy. So we have that regulator that's working with you every single day to remind you your period is coming, because the other products really need to be started 2 days before. So that menstrual pathway, let's just like turn off the faucet a little bit before it gets started. So
Right.
when things start dripping out of the faucet, we're just going to bat them away so that the messages don't come, just keep bleeding, keep cramping. So we're
Love
really
that.
reducing that those messengers, and we're starting that before, just as the messengers are starting to ramp up, we're blocking them, so that you kind of bleed what you need to bleed, get out what you need to get out, which is really like so little tissue, it's tiny, and then you're on back on to your daily life.
So, is it safe to say that y'all are focusing more on the preventative
Yes,
part
yes,
rather than the curative part of the
yes,
whole menstrual health?
absolutely,
That
yes. I think we are
is,
starting a new category, which is preventive period pain.
I love that. And just to like, before I let you go, like, what message do you want to leave with our listeners about the importance of addressing period pain and irregularity?
Thanks for asking. I think the message is Don't be afraid of your uterus and your reproductive organs. Lean in, understand them. They are yours. They're no one else's. They belong
Right.
to you. They're yours to understand and to work with and to feel connected to.
I love that. That is so profound. Thank you. Thank you, Dr. Margo, for your time. And again, like, more power to you and your vision and mission with your company, because I think more women need to listen to this podcast, because at the end of the day, they hold the power.
Yep.
They are the decision makers
Yes.
about their own bodies.
Yes.
And if we are able to educate them in this aspect, I think they will feel more empowered in making the right decisions for their bodies. So, thank you for that reminder. And it was a pleasure having you here on this podcast. And thank you again for your time.
Thank you. Thank you for the opportunity to share a little bit about us. And I just appreciate it so much. Thank you so
Thank
much.
you. All right. Bye. Keep listening to Balm Health Plus podcast.